Hi and welcome. If you've just had a tooth extraction, or you're preparing for one, this video will walk you through everything you need to know for a smooth recovery. Right after your surgery, it's normal to experience bleeding, swelling, discomfort, and even some bruising. You'll be given gauze pads to bite on. Keep firm pressure for about 30 to 45 minutes, and change the gauze as needed. Always moisten the gauze or make sure it is wet before removing. This helps avoid pulling out stitches or disrupting the bone graft. You might notice some blood in your saliva over the next couple of days. This is completely normal. If you ever feel like you're bleeding excessively, contact your dental office or seek emergency care. What not to do? Don't touch or poke at the area. Don't pull your cheek out to look at it. Don't rinse your mouth forcefully. Don't use a straw. And do not smoke or vape. These can cause dry socket, which is very painful and delays healing. Sleep and positioning. For the first few nights, try to sleep with your head elevated, propped up on a couple of pillows. This helps reduce pressure, swelling, and discomfort. Place a towel over your pillowcase to protect your bedding just in case. What to eat? Stick to a soft diet for a few days. Think yogurt, mashed potatoes, soups, lukewarm, smoothies, and protein drinks. Don't forget to skip the straw, and avoid berries. The seeds can get stuck in your extraction site. Avoid anything crunchy, spicy, hot, or chewy, and try to chew on the opposite side of your mouth. Medications. Take all prescribed pain relievers and antibiotics exactly as directed. If your dentist gave you a mouth rinse, use it as prescribed. If not, after the first 24 hours you can start gentle warm salt water rinses after meals. Oral hygiene. When brushing, be very gentle, and steer clear of the extraction site. Use a new super soft toothbrush and avoid whitening toothpaste. Instead of swishing, try to move your head side to side, and then open your mouth to let the rinse out. If you had stitches placed, your dentist will let you know if they need to be removed. Don't try to cut or remove any sutures yourself, and avoid playing with them using your tongue. Contact your dental provider or seek urgent care if you have severe or prolonged bleeding. Swelling worsens after 3 days or spreads to the eyes, throat, or other parts of your face. You're having difficulty breathing or swallowing. You experience severe pain not relieved by medication. You feel signs of infection, like fever or foul odor. If you have any questions, reach out to your dental office. Take care, and wishing you a speedy, smooth recovery.